speaker. Professor and HOD in Rasashastra and Vaishajya Kalpana at Sri Jagadguru SJG Ayurved Medical College, Koppal, Karnataka. He is a successful clinical as well as academic person with multidimensional views regarding theory and practical approaches of Ayurvedic sciences, especially Rasashastra. He is guiding students of post-graduation in various areas of research, especially in mineralogical characterization and their health benefits. He has assisted Professor Siddhanandan Mishra, sir, in translating Ananda Kanda text from Sanskrit to Hindi, also in translating Vaishajya Ratnavali from Sanskrit to Hindi. He has tried many Rasaushadis in various clinical conditions till date with very encouraging results and been practicing Rasaushadis predominantly. He has delivered many lectures in various seminars at national and international level. With this brief introduction, I request sir to start his session. Thank you. Sir, please start.
Thank you, sir. And before I start with this particular presentation, I welcome all the delegates for today's session. And I would like to acknowledge the whole team of Shailaya Rasashala and specifically to my friend Dr. Chinmay Pondekar for giving me this opportunity to meet you elite delegates and try to share few of my ideas regarding the Rasaushadis in autoimmune disorders. I have specified it as something like Vata. That is just because of the reason. It's echoing. Yeah. Amavata is very specific when we want to understand the autoimmune disorders, because some disease we have to take it as an example to understand it in a better way. So I have taken Amavata just because of the reason rheumatoid arthritis is one of the very, very commonly reported clinical condition with autoimmune disorder. And I know all of you would have come across with many of the details about the autoimmune disorders, the pathogenesis of it, the reactions which happens in the body. Why is that this set of disorders are entitled as autoimmune disorders? Why is Amavata taken into autoimmune? All these things from possibly the previous lectures. I'll not be discussing about the conceptual part of the autoimmune conditions at any way. I'll just give a brief introduction in 1 or 2 slides and just jump into the Rasaushadis. Specifically, what all Rasaushadis are being needed to discuss under the heading of autoimmune disorders will be the prime focus for today's presentation. So before we start with this, I would like to salutate to the God for giving the science and adoring the humans with this great thought process of the Rasaushadis into the medical system for the betterment of the humanity. Also, the blessings of the great Acharyas like Acharya Nagarjuna, who has propounded this knowledge in the form of documentations and preachings to the disciples to make it available to us today. So salutations to the teachers and the God for giving this science as a boon. And next thing is about the divine drugs of Rasaushadis. Like, for example, the Pottali Kalpanas. I extensively use lots of Pottali Kalpanas in my practice, also in the conditions like that of the autoimmune disorders. Just because of the reason all these Pottali Kalpanas are said to be having Rasayana effect as a baseline. All the Pottalis are Rasayana. This is the fancy of it. They are very safe. They don't have excess of Ushnata, Tivrata, nothing. They are just protective, and protective. They protect you from every aspect of life. they are having at most efficacy as a rasayana effect, and also they are therapeutically very active, and they're very safe in administration, because the present generation people are so worried about heavy metal toxicity, because we are fancy to read about the Western journals and forget to practice the Eastern science as that of Ayurveda. We practice it with the grounds like we want it to be understood on the grounds like the Western medicine, which is absolutely irrelevant many times. I'm sorry to use that word, but it's really not that feasible to explain X is equal to Y. It's not possible. Maybe you understand both the science on individual grounds, try to treat them and try to interact with them. That's a great thing. But don't try to equate things. Vata is equal to wind, etc. Absolutely nonsense. It's not possible to do those things. But anyway, these are a few of the drugs which are extensively used, and I'll be focusing a lot on Pottilikalpanas because I use them extensively in my practice, and which is a boon for me to use them into many of my patients successively, which has given rebirth to many of such cases related to the autoimmune conditions. Basically, immunity to a disease is achieved through the presence of antibodies to that disease in a person's system. You have something pre-coded in your body which is making you to gain a immunity on a particular aspects of life. And the antibodies are the proteins produced by the body to neutralize or destroy the toxins or disease-carrying organisms. Antibodies are disease-specific. This is in brief about immunity. Might be you name it as Vyadhikshamatva, or might be you name it as something as a Rasayana effect in the body. Might be you can name it as Dhatu Sarata or Ojas, whatever the different shelters you would like to use for this particular concept of understanding the immunity in an individual or to upgrade the immunity in an individual. I try to define immunity or autoimmune conditions in 2 to 3 different ways, just for the reason that you understand the core part of it, so that the treatment I give you a total protocol of what all the drugs can be used in autoimmune conditions. Usually when you want to name it, it's not like you go for HB, TC, DC, SR, fasting, postprandial and all routine investigations. Most of the times we don't recommend anyone to go for immunoglobulin test or any of such tests as a routine in most of the people. But still, based on that, you should be able to understand like what are the basic signs where you have a weak immune system. How can you recognize in a person like his immunity is low? Just clinically. See, everything is not like every time you go on suggesting blood investigations to the patient. At the first sight, try to clinically diagnose the patient. Might be it is a tentative diagnosis. And in case if it's not something like which is going to hamper the patient's life, or you find like you are so confident about your tentative diagnosis, try to treat the patient first. In case if you are able to treat the patient and is responding to your medicines, then great. Forget about other investigations. But still, you don't find your patient is absolutely responding to your treatments, then try to go intervene with the investigations. Try to peep into the patient's body to understand what really is happening to him and try to investigate him. So for that, few of the guidelines for you to understand how do you see your patient with a weak immune system, wherein the patient might have a frequent cold, infection, digestive problems, delayed wound healing, skin infections, fatigue, organ problems, delayed growth, some disorders related to the blood, and of course, autoimmune disorders. There are a whole umbrella filled with lots of autoimmune conditions which are being enumerated in this category. And out of that, at least 13 to 14 are very commonly seen in Indian clinical practice, where you can enumerate the disorders and based on that, try to plan up your treatment protocols. The immune system helps to protect the body from harmful pathogens and other environmental risks. The immune system, the complex group of defense responses found in the humans and other advanced vertebrae, that helps to repel the disease-causing organisms, that is the pathogens. Immunity from the disease is actually conferred by two cooperative defense systems called non-specific. Innate immunity and specific. Acquired immunities. Non-specific protective mechanisms repels all microorganisms equally, while the specific immune response are tailored to particular types of invaders. Both systems work together to thwart the organism from entering and proliferating within the body. These immune mechanisms also help eliminate the abnormal cells of the body that can develop into cancer. Why I have taken the terminology here is cancer. You have a patient suffering from any of the autoimmune conditions. See, sometimes the patient is having recurrent running nose. Might be it's an autoimmune condition. You're not able to identify it in the initial way, you treat him. Then the running nose has been addressed. Then within 2 weeks, again the patient comes back with the same complaint. Again you treat him. Again it repeats. So the cycle continues. Then ultimately what you do, you try to go for an investigation. You'll come to know like there are some alterations in the blood chemistry. Then you try to treat him on those grounds. The patient responds at a particular time once you practice with that of the rasaushadis, just because of the reason most of these rasaushadis are having rasayana effect. All the metals are rasayana in nature. The whole index of rasashastra is rasayana shastra. It is having rasayana effect, provided you have prepared it in a proper way. In case if you haven't prepared it in a proper way, anything could be toxic. That's a different set. But still, you might say something like, sir, it's a simple running nose, might be any number of times he has been infected. Let him take some antihistamines, might be any of the anti-allergic like drugs, and his simple cold has been addressed. Let him suffer. He comes to me frequently because I'm a doctor, I get good business. But this is not enough. Just because of the reason all these autoimmune conditions are interlinked many times and they cause some other disorders related to autoimmune system, like that of cancer. So even cancer is many times because of the immune system. The weak immune system can cause cancer. So on that grounds, what you need to do is always at an outset, try to treat the patients who are been suffering from autoimmune conditions. How is that basically you need to do this? Say for example, most of these diseases are in waves. You have waxing and waning, you have ups and downs. Say for example, psoriasis. It is also an autoimmune condition. So what you have with psoriasis, the patient will have a crop of psoriatic attack in the form of a skin presentation. You started treating him with some Gandhaka Rasayana, you treat him with Panchatikta, you give him some Khadira preparations, some Manjishta preparations, you give him a set of Virechana, might be what all XYZ protocols. Then later on, the skin lesions are disappeared. Then what you do? You ask the patient to take the medicine for some more time, but the patient feels I'm totally fine. Why should I take the medicines unnecessarily? The doctor is expecting me to just dump his medicines into my body. I don't want to take it when I'm not ill. I don't have skin lesions. Why should I continue the treatment? Then he discontinues your treatment. And after 1 or 2 months or even 3 or 6 months, he have another crop or he has another episode of psoriasis now. Might be it is because of most of the times I give the hetu or the nidana, most of the times it is pragnaparada. Because people will not understand the seriousness of it. They do some mistake in respect to rutu or some ahara, vihara, whatever it is. And they land up into some autoimmune conditions back. So again they come back to you. Then what happens? Again you give them some Kushtagna treatments. And he goes away. And many times I'm unfortunate to see even doctors have asked them, no, there is no lesion, you need not take any medicine, just keep quiet. They explain, if he comes to the Ayurvedic management, many of the people explain about Patya and all those things. And they ask them like, yeah, that's fine, great. But the unfortunate part is they're absolutely not addressing the autoimmune system, which is supposed to be addressed. Normally in all these psoriasis-like conditions, any of the autoimmune conditions, you need to address the immune system, not the Kushtagna Chikitsa. You are supposed to give him Rasayana Chikitsa, absolutely not Kushtagna. If you want to capture the patient, or you want to see, like, you want to gain more confidence of the patient, you need to say him like, okay, fine, I'll treat initially at an outset as Kushtagna. Once the lesions of psoriasis has been disappeared, then I give him Rasayana Chikitsa together and continue the Rasayana Chikitsa for a long time till the autoimmune condition has been responded. Like few of the examples, I am really fond of administering in such conditions with Hemagarbha and Pravalagarbha Potalis. This is a real essential factor which you need to use it in psoriatic patients, because there are something called as specific immune drugs to particular system. And this Hemagarbha, which is having gold as a component, is very good stimulant for the immune system all around. And also it is Ojo Vardaka, Dhatu Sarata, and also it is essential for so many factors in the body. The next thing is Pravala, because Kushtagna, Pravala is also Kushtagna, Pravala is also Rudhya, Pravala is also good in autoimmune conditions, and also it is related to the Shrotas of Rasa and Raktava Shrotas, from where Kushta has been origined. So what is the Dhatu involved in Kushta? Rasa, Rakta, primely, might be even Mamsa many times. So the drug of choice is Pravala, and also it is Rasayana. See the fancy of it. The Swarna and Pravala are such components which is protecting the heart, because in all the autoimmune conditions try to protect the heart, because the usual complication in autoimmune condition is cardiomyopathies, or you have some cardiac problems, because the chief tissues affected are Rasa and Raktava Shrotas, many times even the Pranava Shrotas, and the Mula Sthana of most of these things is the Hridaya, like the Rasava Shrotas and Pranava Shrotas Mula is Hridaya. So the Mula Sthana has been affected, the person dies because of the cardiac arrest. Might be it is Amavata, might be it is psoriasis, or might be it is Stronger syndrome, whatever the various disease condition the patient is suffering from, including the ulcerative colitis, like clinical pathologies, or even cancer, for example. Treat at an outset. And second thing is, heart is also considered in Ayurveda as Ojas Sthanam. So the Sthanam of the Ojas should be protected so that the patient will not die. Try to see that patient should not land up into cardiac complications or emergency conditions, and try to treat him at an outset. So you need to give them with Hemagarbha Potali and Pravala Garbha. You don't have Potalis with you, Swarna and Pravala. Might be it is Pishti, Basma, whatever you get, that is a good choice. You need to plan up and try to see that you have to give all these medicines to the patient in a long run. Usually what I do is I take Amalaki Rasayana, and I take Amruta, and I take Gokshura, I take Swarna, I take Pravala. All these things in a combination has been given for months and months together, just to rectify the Rasa, Raktava Shrotas and also the immune system. By this, what happens? The whole of the system has been detoxified and the immune system is significantly boosted up. And it is significantly boosted up, by which you have an excellent response in the patient. This is for sure. The patient who is to have a psoriatic attack once or twice in a year will be something like in every 2 to 3 years he will start having 1 or 2 attacks. Eventually he'll have it in 5 years and eventually it disappears, because you are addressing the immune system. You are not really behind Kushtagna Chikitsa. Kushtagna Chikitsa is a very, very superficial treatment in psoriasis. The actual treatment is the autoimmune disease where you have to treat. This is a general guidelines for all autoimmune conditions, because you try to observe most of these autoimmune conditions are with episodic attacks. They have multiple attacks. You cannot address the situation in one go. You need to address them multiple times. This is how you need to tackle with that of immune system. The immune system disorders, any of the various failures in the body's defense mechanism against the infectious organisms. Disorders of the immunity includes immune deficiency diseases, such as it can land up into AIDS that arises because of the diminution of some of the aspects of the immune response. Other types of immune disorders, such as allergies or autoimmune disorders, when the body develops an inappropriate response to the substance, either to a normally harmless foreign substance found in the environment, in the case of allergies, or to components of the body in case of autoimmune diseases, like the lymphocytes, the white blood cells in the immune system can become cancerous. So this is how it lands up into tumors, lipoma, lymphoma, myelomas, any of the irrelevant growth of the cells multiplying, which is named as cancer. So to understand it in a very, very simple language, if not too complicated, an autoimmune disease is a condition in which your immune system mistakenly attacks your body. So it is something like you hit yourself, the same way as the autoimmune diseases. The immune system normally guards against germs and bacteria and also the virus. When it senses these foreign invaders, it sends out an army of fighter cells to attack them. And this is called as autoimmune response. This mechanism is lost in these people who are suffering from autoimmune disorders. Normally, the immune system can tell the difference between a foreign cell and which is your own cell. This mechanism is lost. When you read the chapters of Abraka, when you read the chapters of Swarna, when you read the chapters of Taraksha, Pana, you will come to know there is a terminology used there. Also in Kantaloha, he uses a word called as Pragna Bodhi. In the Falashruti of the Basmas, he explains you a term called as Pragna Bodhi. Means where you have done the Pragna Parada in the form of autoimmune disorders, knowingly you do some mistakes. So those are to be rectified. How is that you educate your cell to say that your cell is doing a Pragna Parada? It is mistakenly attacking its own self. It is something like you are hitting yourself. The same way your cells are also defaultingly doing some mistakes in the body, and those things are to be rectified by the administration of a set of drugs called as Pragna Bodhi. They are to be addressed well with Pragna Bodhi set of drugs like Abraka Basma. So by giving Abraka, what happens? This mechanism of Pragna Parada by the cells to mistake itself in the body is being rectified. So the Acharya has used the term called as Pragna Bodhi. You re-educate the cells of your body. In a autoimmune disease, the immune system mistakes the part of your body, like your joints or skin, as a foreign. It releases proteins called as autoantibodies that attack the healthy cells, and this causes complications. Some autoimmune diseases target only one organ, like as you see in case of type 1 diabetes, damages the pancreas. Other diseases like lupus affects the whole body. So this is how it have a different set from one to another. So these are autoimmune disorders, like list of 14 commonly autoimmune disorders among 80 plus types, which is very commonly seen in India. Like you have the type 1 diabetes, rheumatoid arthritis, psoriasis or psoriatic arthritis, multiple sclerosis, systemic lupus erythematosus, inflammatory bowel disease, Addison's disease, Graves' disease, Sjögren's syndrome, Hashimoto thyroiditis, myasthenia gravis, vasculitis, pernicious anemia, celiac disease. All these disorders are, I'll say, you commonly see these conditions in regular clinical practice. Very commonly you see. Even presently, I'll say I have presently some 3 or 4 cases of Sjögren's syndrome. So in this particular thing, absolutely I'm not treating them with anything. They're having myalgia, clinical presentation, weakness, lethargy, everything is there. The only thing I'm giving is that combination of Swarna, Pravala, Amalaki, Amruta, Gokshuta. Just because I'm considering as a rasayana and adjust the autoimmune system. And I have started the treatment. And I'll say the patient was so much dependent on steroids from past few years has withdrawn eventually. Now she's totally out of the steroidal protocol. And now she is maintained only on Ayurvedic medicines. For the first time in the past 8 years, the patient had relief from lethargy, pain and discomfort. So this is the fancy of Rasaushadhis. This is how we have to plan up our protocols, understanding the autoimmune disorders in any of such clinical pathologies, so that you can understand the disease in a proper way, and the core part of the treatment is to rectify the autoimmune disease and absolutely not the clinical presentation. The clinical presentation ought to be addressed well just to capture the patient or just a palliative type of management, not very serious. The autoimmune diseases symptoms, the early symptoms could be something like fatigue, achy muscles, swelling and redness, low-grade fever, numbness and tingling in the hands and feet, hair loss, skin rash, Individual diseases can also have their own unique symptoms, as you can see in case of diabetes and all. So anything like that could be present. Normally, where we go with Amavata Chikitsa or autoimmune therapy in the Rasa Shastra, I'll say managing with autoimmune disorders in case if you are a Pakka Rasa Vaidya, it is very easy. I'll say just close your eyes and lift any basma and give it. It'll act. This is for sure. Only thing is you have to just try to suit it with a particular anupanam which suits to his prakriti or his nature, what is a clinical presentation of the patient. Try to just suit it and give. But let me be more rational enough and I'll give you a list of drugs which all can be given. Few qualities are expected in the drug to act on these set of illnesses, and these drugs should usually have the Ushna Viryata, because the Agni is important. There is some vitiation in the Agni in the body, and the vitiation of the Agni to be rectified well, for which you need some Ushna Viryata, where you need the drugs which is of Ushna Virya. There are lots of channels which are being blocked in autoimmune conditions, and you need the Abhishyanda Hara set of drugs. And the patient usually complains of lack of appetite. You need to give him with Agni Mandya Hara set of drugs. And even though he says like I eat, but it doesn't digest to me, that is Ajirana Hara set of drugs you need to give. And what is the cause of this? It is Ama. So it is Ama Vikara. It's not properly transformed. So you need to give them with Ama Vikara Hara. And where it is formed, Ama and all these things are formed specifically from Amashaya. It is Udbhavasthana of the Vyadhi most of the times. So Amashaya Balapradha should be used. So you need to address the Udbhavasthana Chikitsa, wherein you strengthen the Amashaya, the disease will become weak. The pathogenesis will turn weak because you are capturing the root part of the disease. That is Amashaya. Next is Amavatahara. I'll say Amavata is an excellent chapter. If you can understand the diagnostic tool and also the list of drugs which can be given in Amavata, it is a general guidelines to understand all autoimmune diseases in one set. Of course, Deepana and Pachana are few of the qualities to be expected. Added to this, what all you might need? Essential components or the Rasayana set of drugs, because even advised as it's a chronic disease and should develop the Vyadikshamatva property in the patient to compete the illness. So on this ground, the drugs of the following qualities are to be planned in the Chikitsa in a long run. So what are the qualities of a drug which you expect with? They should have the Amruta Guna Yukta. They should adore the Ayushya, means it should increase life expectancy, because most of these autoimmune conditions, the patients will die faster. So you need to increase their life expectancy by giving the Ayushya set of drugs. Rasayana therapies like Shadrasayukta Dravyas, strengthen the patient by Balya Dravyas. Ojo Vardhana, wherever you find the Dhatu Sarata has been affected or Ojo Kshaya has been observed in the patient, try to treat him by giving the drugs like Ojo Vardhana. Rasayana is essential component because the Dhatu Sarata is to be addressed. And also Rut Balyakara, Ojasthana, and also the Mula Sthana of the Pranava and Rasava Shrotas. So Rut Balyakara and Rut Rogahara. All the rheumatic conditions or all the autoimmune conditions someday or the other will affect the heart. Many times this is quite possible. Try to strengthen the heart prior to the patient is being affected with any of the cardiac disorders or grave complications. Manasika Vyadihara, because many of them will land up into depressions as they don't have proper treatments in any of the contemporary sciences. They run from doctor to doctor with absolute no response, and one fine day they lose their hopes. Even after so much of efforts, the disease doesn't come to control. Then it becomes asadhya. Then the following set of drugs to be used like asadhya roga nashtakara. Rasa Shastra is the only science where this particular terminology is being used. Or else many times we read about with various samhitas and textbooks where they say, of course, some diseases asadhya, some diseases kruchra sadhya, don't treat it. Even some textbooks have explained like by attempting to treat the asadhya vyadis, you will lose your fame because the disease is however not going to respond. So you have such things which has been explained in few of the textbooks. But Rasa Shastra is one such a sportive science where he says a list of drugs called as asadhya roga nashtakara. Even though the textbook has said asadhya, we can treat it with Rasaushadhi. So you have a set of drugs called as Asadhya Roga Nashtakara. But even after that, the patient might have landed up into some complications where he is on his deathbed, might be he's on the ICU bed or anything, he's supposed to die. So you want to ward him off from death, then you have a set of drugs with Rasaushadhis. They are called as Mrutyuguna, to ward off the death. So this is how the fancy of Rasaushadhis is so popular even today. You can ward off death by administering some medicines called as Mrutyuguna set of drugs. Also, as well known, it can, in chronicity, can lead to or associate with other complications or diseases, and it causes Vyadhi Sankara syndrome-like presentations. A patient having some autoimmune disease like psoriasis can land up into psoriatic arthritis, psoriatic or rheumatic heart disease, rheumatoid arthritis, rheumatic fevers. The patient will land up into diabetes eventually, then to hypertension, multiple organ failure, cardiac arrest, death. Syndromes where you have multiple systemic involvements. So Rasaushadhis are having answer even for this clinical conditions. It's called as Sarva Vyadhihara. I don't know, the patient is suffering from BP, is having sugar, is having arthritis, the patient is having some thyroid issues, the patient has come to you with a complaint of some psoriasis, etc. Multiple systemic involvement. I am really unfair enough to practice wherein drug for BP, one drug for sugar, one drug for arthritis, another drug for anything. It is something like dump him with some 15-20 combinations. It is absolutely foolish to practice in that way. They will still act poorly, but still, it's not the right way of practice. You're not an experienced Vaidya. When we were students, we were never permitted to prescribe not more than 3 drugs, or maximum is 4 drugs. Then you are said to be an expert because you have mastered it. You can manage it. So there were a few of my teachers where they say Ekadravya Prayoga, Ekamulika Prayoga. That's all, one drug. Then you are the real super specialist in Ayurveda, in case if you can do that particular practice. We were never permitted to give 8-10 combinations. Absolutely no. So on that grounds, Rasa Shastra has brought you a ready platter like Sarva Vyadhihara. All treatments of multiple systems can be done in one set of drugs. They are called as Sarva Vyadhihara. Based on the disease conditions and the avastha of the patient, either of the above said drugs can be used with their specifications enlisted from the various textbooks as mentioned here along with the references. Usually what happens, Sarvan Rogo Mandaganav is the prime fact to be well understood for the treatment, which is very true in the diseases like Amavata or the autoimmune disorders as well. So the set of drugs with Ushna Guna is required for palliating Ama, which is the basic component of Amavata. The set of drugs with Ushna Guna are as follows. There are list of drugs which are called as Ushna Virya, which could really help in many of the autoimmune conditions because you want to rectify the Agni. Might be it is Dhatu Agni, Bhutagni or Jataragni, whatever it is, but some Agni there. Some metabolism is being altered. So you need Ushnavirya Dravyas. And they are Shilajatu, Chapala, Gandaka, Kasisa, Spatika, Haratala. These are directly from the textbook. The first thing what you can see, the first column is about the list of drugs. The second one is about the classical references from the textbook. The next one is about the chapter number and shloka number. Like Shilajatu, Ayurveda Prakasha, 4th chapter, 103rd shloka. So this is how everything is from the textbook. So please refer textbook for further details. You have Hartala, Manashila, Kankushta, Kampilaka, Navasadara, Varatika, Tamra, Vanga, Naga, Pittala, Kamsya, Gomeda, Vaidurya. All these drugs can be given based on the classical references. Suryakanta, Dugdha Pashana, Tankana, Langali, Datura, Vishatinduka, Arkakshira, Vatsanaba. Similarly, if you have the clogging of the arteries or vessels or shrotasas, Abhishyandra Hara drugs like Karavira and Vatsanaba could be given, which could release the channels from various blocks in the body. This is what Acharya is claimed from the textbook of Rasatarangini 24th chapter. So you can give Karavira or Vatsanaba to these patients wherever you are expecting Shroto, Sanga or Avarodha. Agni Mandyahara, wherein the patient is having poor Agni, which is a most grave complication of any of the terminal phase of the diseases. It could be a very minor essential component wherein the patient might have a simple lack of appetite, or the patient might complain you stating like drastic Agni Mandyata leading to death with malnutrition or undernutrition, avitaminosis, etc. All the metabolic disorders or any of the nutritional disorders landing up into the grave complications. So for that you need to give a set of drugs called as Abraka, Vaikranta, Makshika, Shilajatu, Gandhaka, Manashila, Gauri Pashana, Navasadara, Varatika, Hingula, Rajata, Tamra, Kantaloha, Vanga, Naga, Muktashukti, Panna, Pusharaga, Rajavarta, Shankha, Tankana, Bhang and Vishatinduka or Vatsanaba. Ajirna Vinashanam. Some patients will say, sir, I find appetite, I eat, but it doesn't digest. Then in those people, try to prescribe them with that of Bhang and Vishatinduka. This is the opinion of Rasatarangini 24th chapter. Ama is a reason why many of these disorders are being origined. So you need to treat Ama at an outset for various clinical conditions. If at all you find Ama Lakshanas in the patient. And if so, you have to treat the patient with Abraka, Shilajatu, Gandhaka, Kampilaka and Tamra. There are huge benefits by going with Ama Vikaras. The next thing is Amashaya Balaprada, Bhang to be given to the patient so that he doesn't land up into Amashodhavyadis. Ama Vatahara, Hingula, Kantaloha, Gunja, Ahifena and Vatsanaba. Deepana. Most of the basmas are being processed with Agni Sanikarsha, where you are given multiple putas. Abraka, you have given some 30 puta, 50 puta, 100 putas, 1000 putas, etc. You are given so many putas. So on that grounds, what happens? It is having the Deepana and Pachana qualities as essential components. It will have all Deepana and Pachana qualities in it. So that's the reason Samskaram Gunantaradhanam is being explained in our textbooks. They are having that Agni Tattva. This is the reason why whenever you are planning to give the Rasaushadhis, you need not much consider about the concept of Agni, that this and all, because they themselves are Agni Tattvas and they don't need gastric fire to digest them, and the amount of medicine or the dosage of medicine which you give is very, very less. You are giving hardly half rati to 1 rati, which is a very minimum quantity. So this is the fancy of Rasaushadhis. That is the reason why you have to take Rasaushadhi at an outset for a successful clinical practice. Other set of drugs could be something like Manikya, Mukta, Neela, Vaidurya, Pyrojaka, Godanti, Vishatinduka, Vatsanava, Gandhaka, Varatika, Agnijara, Tamra, Kantaloha, Vanga, Naga, Vartaloha, Pravala, Panna. Sharaga, Vajra, Gomeda, Rajavarta, Vishatinduka. This is what I said. The index of Rasaushadhi is coming to Deepana and Pachana. The Pachana set of drugs could be something like Gandhaka, Navasadara, Varatika, Hingula, Vanga, Pravala, Pusharaga, Gomeda, Rajavarta, Vishatinduka. Swastha Purusha, Swasthasya Swastha Rakshana Maturasa Vikara Parashamanam. The text of Ananda Kanda has asked us to eat Parada and Gandhaka on every day, called as a Nitya Rasayanam or Nitya Sevana, so that it can ward up from many of the disorders. Unfortunate part, when I ask someone to take Parada and Gandhaka on everyday basis, they will ask, sir, will I not land up into some renal toxicity or heavy metal toxicity? Absolutely no. In case if you have prepared a proper Parada and Shodhana, Gandhaka Shodhana and prepared a proper Kajali, you will never land up into any of such complications by Nitya Sevana of Parada and Gandhaka. This is what the textbook of Ananda Kanda is claiming. It's not my opinion. But anyway, the Shatrasa Yukta Dravyas, which is also encouraging you to have the Rasayana effect in the body, is achieved by taking the Vaikranta and Vajra. This is the opinion of Ayurveda Prakashan Rasatarangini. Rasayana set of drugs which have the Amruta Guna or Abraka, Makshika, Kantaloha and Vajra. This is what Rasaratna Samuchaya and Rasatarangini claim about. Ayusha set of drugs which can increase the Ayu of the patient. Again, the whole index of Rasa Shastra comes into here. Because every drug is Ayusha. Every drug of Rasaushadhi you take, it increases the life expectancy of a patient. This is what the textbooks are speaking about. Absolutely, it is not my words. Like you have the set of drugs like the Abraka, Vaikranta, Swarna, Rajata, Tamra, Kantaloha, Naga, Manikya, Mukta Shukti, Pusharaga, Vajra, Vaidurya, Makshika, Vimala, Shilajatu, Tutta, Gandaka, Haratala, Manashila, Rasanjana, Neelanjana, Kankushta, Hingula, Swarna, Rajata, Kantaloha. All these are even Rasayana set of drugs which increases the Rasadi Dhatus. Kantaloha, Vanga, Manikya, Vajra, Rajavarta, Suryakanta, Ballataka, Vatsanaba. So all these drugs can be given as Ayushya and also as Rasayana in effect. Vaikranta, Makshika and Manashila, even though you have used it as a component in any of the formulations also, it is Rasayana. Sankochakaranadinam Balakrit, where there are some of the clogging of the vessels or the shrotasis, then it should be released by administering with Tutta, Kasisas, Patikan, Mruddhara, Shringas. Sarva Vyadihara, syndrome-like presentations or multiple clinical presentations of the patient. Patient is suffering from psoriasis, psoriatic arthritis, rheumatic heart disease, rheumatoid arthritis, many of such complications. In that case, you are supposed to treat the patient with the drugs like Abraka, Vaikranta, Makshika, Gandhaka, Hingula, Swarna, Rajata, Kantaloha, Naga, Vajra, which is Sarva Vyadihara, which can be given in multiple clinical presentations with many disorders. Asatya Roga Nashtakara, Abraka and Makshika to be prescribed. Dhatu Vivardhanam, Swarna is given. Ojo Vardakam, Haratala, Swarna and Panna are to be advised. See how unfortunate we are. Haratala we don't want to practice because we consider arsenic is a great toxin and it is going to kill our patient, so we don't want to use it. Swarna, no, we don't want to use it because it is too expensive to the patient. My patient is always very poor. He can invest lakhs and lakhs of rupees on chemotherapy, but is not ready to invest 500 to 1000 rupees for Ayurvedic management. So Swarna, I don't want to give it to my patient because he's not that economically strong. The next thing is Panna. Who is having Panna? Who is seen Panna to make it as pistis and basmas? So Panna is not available. Swarna I don't want because it is expensive. Haratala, it is a toxin. I don't know how to give. So on the whole, as single drug therapies, we don't want to use Ojo Vardhaka set of drugs. Unless and until you practice with these three set of drugs, either it is Haratala or Swarna or Panna, you will never success in achieving the Ojo Vardhaka property in an individual. You might get Ojo Vardhaka property because of the Swastha Vrutta. You might have it in the form of a formulations which is having Ojo Vardhaka quality, like Hemagarbha Puttali is having Ojo Vardhaka. But when you want to practice, when you want to make yourself as a super specialist, you are supposed to give them with single drug therapy. You can go with just Haratala or Swarna or Panna, which would be a great choice to increase the Ojos of an individual. Comes out with the Mrityugna set of drugs, which could be a great choice to ward off the death in the patients who are suffering from critically ill disorders like that of the autoimmune conditions with emergencies. Practice them while administering with Abraka, Makshika, Shilajatu, Gandhaka, Haratala, Kantaloha, Naga and Vajra, which are the set of drugs prescribed by the various textbooks to be given in such clinical pathologies. Pushtivardhana, Mauptika Shukti and Panna are being prescribed by Ayurveda Prakasha. Pushtikara, Kantaloha and Shanka are being prescribed by Ayurveda Prakasha and Ananda Kanda Kriya Karana Ullasa. Balyakara, Gauri Pashana and Vishatinduka, cardiac protection is at most important. Rudrogahara, Makshika, Tutta, Navasadara, Swarna, Rajata, Kantaloha, Mukta Shukti, Vajra, Pairojaka, Dugdha Pashana, Tankana are to be given. Rud Shulahara, Shilajatu, Tutta and Gauri Pashana are to be prescribed. Manisika Vyadihara, Gandhaka, Manashila and Spatikamani are being indicated in Manovyadis. The autoimmune survival kit should have the pottalis. Like usually this is the Lohagarbha pottali. Very commonly I do give it in the disorders where I expect the drug to stay for a long time in the Raktavashrotas. As you can see in the skin presentations and in malignancies. Where I want the drug to act for a longer time, then I associate it along with Lohagarbha. This is extensively useful Lohagarbha pottali, which can be given in many of the clinical pathologies, which is having a clinical presentation as Sangrani, Pandu, Kamala, Raktakshobha, Prameha, Pradhara, Netra Rogas. The next thing is a Mallagarbha Pottali, which is extensively useful in many of the clinical pathologies related to the Vata and Kaphaja disorders. It is also indicated in the diseases like the Jwara, Shleshma, Vata Vyadhi, Upadamsha, Phiranga, Bagandhara, Nadi Vrana, Shwas and Agnimandya. Tamragarbha Pottali specifically in Vata and Kaphaja condition and chronic in origin, then Tamragarbha is a boon to people of those kinds. Afolbana Tridoshaja Shwasa, Kasa, Jwara, Shula, Vardakya, Shosha, where you need Tamragarbha Pottali. Rajatagarbha Pottali, specifically given in the clinical conditions related to the Rasayana effect. It is Soumya Dhatu. It is a boon for the females. So usually for the disorders of the gynecological issues, Rajatagarbha is a boon. And also disorders related to the Prameha, Shukradosha, Pitta Vikriti and Mutra Vyadhis. We prescribe it. Vishagarbha Pottali is an excellent choice where it can be prescribed in the clinical conditions where you have the spread of the illness. Like might be it is typhoid, malaria, or even including the metastasis of the disease. Where it spreads from one area to the another area, Vishagarbha Pottali knows how to arrest it. It is also indicated in the conditions like Upadamsha, Phiranga, Vatavyadi, Kshinata, Shleshma Vikara, Raktadosha, Bagandhara, Kushta, Nadi Vranas. Tridhatu Garbha Pottali specifically with teratological or genetic issues or pediatric practices or adamant disorders like the autoimmune and metabolic disorders. Prameha, Putimeha, Pradara, Shukradosha, Shukradi Dhatu Vivardhanam is usually done with Tridhatu Garbha. Shilagarbha Pottali, almost a miniature of Mallagarbha, where considering the Taratama Bhavas of the Pitta factor in the patient, you can go with the Mallagarbha or Shilagarbha. The next is Talagarbha. This is Talagarbha again. Pravadagarbha again, it's a beautiful drug combination. Rasa Raktavashotas, Bala Sukumara, Vardakya disorders and all these clinical conditions where we go with Pravada. Also it is Rudya. Pandu, Udara, Kasa, Shwasa, Gulman, Bala Rogas are indicated in the textbook. Ratnagarbha is a choice to you in such conditions where absolutely no drug is responding to your patient. Then give Ratnagarbha at an outset. It will treat it. Rasadi Ojo Vardhana in the Raja Rogas indicated in the diseases where no other medicine is working. Then you give Ratnagarbha. Hemagarbha Pottali, almost an essential component in every patient which I prescribe for autoimmune disorders. Rajakshma, Raktakshobha, Jirnajwara, Ojakshaya. Rasagarbha Pottali is a very good vehicle where you can suit it with a proper anupanam and give it to the patient. It's a Deepana, Pachana, Yogavahi, Kasa and Shwasa. But various Dhatugata Rogas, Rasa and Raktava Shrotas, Lohagarbha and Pravalagarbha could be the choice. In case if it is Mamsava Shrotas involved, Tamragarbha, Vishagarbha and Rajatagarbha, Medova Shrotas, Talagarbha, Shilagarbha and Rajatagarbha, Astiva Shrotas, Pravalagarbha and Tamragarbha, Majjavaha Shrotas, Mallagarbha and Rajatagarbha, Shukrava Shrotas, Tridhatu Garbha, Ojas, Hemagarbha and Ratnagarbha. This is a ready protocol which can be used in various Dhatu levels. Few of the prescriptions for the Kalve Rasayanas where it can be given in such conditions is the Mrutyunjaya Rasa, Arogyavardhini, Jayamangala, etc. This is a case of multiple sclerosis, which was an autoimmune condition related and was being treated with Hemagarbha, Ekangaveda, Chandraprabha, wherein the patient has responded. This is another case of trigeminal neuralgia, again a condition of autoimmune disorder. This is MRI report of the patient with a trigeminal neuralgia treated with Makaradwaja Rasayana along with that Hemagarbha and Abragarbha Pottali. This is a successive MRI reports of the patient where you can see the trigeminal now turns to be normal. Similarly, the thyroid complaint, especially with the Hashimoto thyroiditis and the goiter-like presentations. This is before treatment where you can see the TSH is 12.3. Simple drugs like Tamragarbha, Chandraprabha and Arogyavardhini was given to this patient. After treatment within 45 days, it is turned to 6.06. This is again goiter case with a clinical pathology of autoimmune conditions. You can see the changes in the nodules. SLE patient, Pravala Garbha, Jayamangala was at an outset. When Hemagarbha is given to the patient, this is the Ananda Thaila used in such clinical presentation, where we prepare the Thaila using the media as Jasada, Gairika along with Raktavargiya Dravyas. This is a kalka of the same powder. Type 1 diabetes also been managed with the same autoimmune condition. This is ulcerative colitis. The patient had 30 to 40 blood-stained stools, addressed very well by giving Pravala Garva Pottal in the form of Picha Basti. So I coined the term called as Basma Basti, and we have given it to the patient. See how beautifully the patient is responded eventually, and we have anatomically changed the structure of the patient's body. We have taken nearly 12 to 15 months to rectify this. This is again ulcerative proctitis case, wherein the same way we have introduced in the form of Matra Basti, the Basmas in the Matra Basti. Rheumatoid arthritis, clinical presentations where the patient will have the muscle pain, which could be seen in case of fevers, muscular rheumatism, electrolyte disturbances, vitamin deficiencies, thyrotoxicosis, peripheral neuritis, subacute combined degeneration of the cord or dermatomyositis. Rheumatic fevers, AMA conditions where you have the fleeting pain, low-grade fever, heart involvement. The treatment is same, Mrutyunjaya Rasa Arogyavardhini. I have a patient with RHD wherein the patient was being treated for almost 12 years with a continuous usage of Mrutyunjaya Rasa and Arogyavardhini. Absolutely, the renal profile and other issues of the body were totally normal, even though administering of some mercurial compounds for more than a decade's time. Rheumatoid arthritis usually affects the peripheral joints. Swelling, heat, pain and stiffness usually seen. Ulnar deviation is being observed. Muscular wasting around the affected joints. Exacerbation and relaxation in the symptoms. RA test is positive most of the times and ESR is being raised. Psoriatic arthritis is the same thing with the skin presentation. In both of these clinical conditions, again the same thing, like usually we go with Mrutyunjaya Rasa and Arogyavardhini. Might be you can go with Hemagarbha and Pravala Garva Pottali in case if it is psoriatic arthritis. If it is only rheumatoid arthritis, Hemagarbha was sufficient. Treatment of Amavata, just to have a guidelines about various autoimmune conditions. Vyadhi Pratyanikam, Shodhanam, Pachanam and Langanam. Mukhya you can plan to go with that of Guduchi, Shunti, Balataka, Swarna, Hingula, Gauri Pashana, Rasna, Shallaki, Punarnava, etc. Abhyantara Shamanaushadis, Amavastam, Mallagarba Pottali, Vishagarba Pottali, Vata Vidvamsa Rasa, Mrutyunjaya Rasa with Ushnodaka, Rasna Saptaka Kwata could be given. Pakvavasta, Samira Pannaga Yoga Raja Mishrana, Ballataka Valeham, Tamra Garba Pottali with Rasnadi Kwatam, Dashamula Kshiram. Jirnavastha, Hemagarbha Pottali, Abragarva Pottali, Swarnavasanta Mishrana, Swarna Yogaraja, Eranda Paka, Gudavallataka with Kshiram, Varnadi Kasham, Rasnadi Kwatam could be the choice. Panchakarmopachara, Virechana, Niruhabasti, like Dashamula Niruhabasti is preferred. Bahya Shamanopacharas like Svedana, Valuka, Avagaha, Nirgundi Bashpa Sveda, Lepam will be Krishna Bola Lepam, Agni Chikitsa Lepam, Lata Karanja Ballataka Taila Pratisarana, Snehanam, Vishagarba Tailam, Vedana Haratailam, etc. like Thitailam could be applied. Patya based on the clinical presentation of the patient, you can go Rogochitam. Thank you very much for giving this opportunity to share a few of my ideas. Any of the doubts or anything you people have, you can raise your doubts and we can try to solve any of the doubts related to it. Thank you.
Hello, sir. Hello.
Yeah.
Thank you, sir, for very nice session. Can you please elaborate some more about the thyroid associated using thyroid?
Yeah. See, the basic phenomenon which is happening in the thyroid pathologies. One thing is because of the autoimmune condition. The second thing is because of some metabolic derailment. Basically, we take it on the grounds of Ayurveda as only the Agnija Vikaras. They are Agni. So normally what we do is at an outset try to treat the Agni, that is a Mula essential component where you need to rectify in all the thyroid conditions. Either it is hypo or hyperthyroidism. So for that what we do is usually we plan up to go with the Tamra Garbha if it's a chronic origin, especially because the patient is already taking some thyroid medicines from the contemporary sciences from past 1 year, 3 years, whatever. Then we try to go with the administration of the Tamra Garbha, which is something like Agni Tattva, which itself will rectify or repair the liver and make it to synthesize in a normal way and try to address all the metabolic conditions. Of course, the oral medications like the Chandraprabha and Arogyavardhana are usually been associated with it, where it is at most useful to address, and absolutely I make no difference between hypo and hyperthyroidism. Both are extreme conditions of Agni and we are treating both the components in the same fashion. And many times I got a very, very encouraging response in the patients of either kind. Of course, I need to select the Anupanam based on the clinical pathology, like how the patient is presented with. I usually go with Dashamula or Indukanta Kashayam as an Anupanam for most of these clinical conditions. Many times I also advise to give some external applications on the thyroid organ just to have a good encouragement and have a good synthesis of the thyroid organ, because it has become very lazy from past few years since the patient is taking some contemporary supplements. So this is how I try to manage. Of course, depending on the organic changes of the thyroid, you might have to go with few of the alterations. That's all. So this is how we try to manage it.
Thank you, sir. Thank you. It was very nice of you.
Yeah.
Thank you.
Yeah.
Hello, sir.
Yeah.
Hello.
Hello. Yeah, it's audible.
Yeah. Thank you for you have given a lot of wide scope for this Potali Kalpa. Because myself, I'm practicing Rasaushadis. I'm preparing myself with Kopi Pakwa Rasayana, Basma, all these things. But I haven't explored in Potali Kalpas. So thank you very much. And whether it is possible that will you give some practical sessions for how to prepare all these portalies?
Yeah, definitely. It can be planned up because I have many things already available on YouTube. You can watch them, and we have explained many of these things, even the method of preparation, the clinical utility of it, and all.
Okay.
And we have done even many courses on this.
Okay. Thank you very much, sir.
Yeah.
Hello.
Yeah.
Hello. Sir, is it mandatory that when we are using Rasaushadis in Pitta Prakriti patients, that there is a variation dose, and is that like we use Praval and all these things like alongside?
No, absolutely no. Only in case if you find it as a too sensitive patient or his pitta factor is so high, then we go with Pravala, Godanti, Madheshti or anything of those kinds. Or else usually we don't do. In a normal protocol, we go based on the doshas. Usually Vata and Kapha, we go with that of more of Vata Kaphaja, we go with Tamra. Where it is Vata Kaphaja with more of Kapha, then we go with Haratala and Malla preparations. If it is more of Pitta, then we go with Pravala preparations.
Thank you, sir.
Yeah.
Sir, in SLE case, you have mentioned one Taila. That is for, you have mentioned, I think, Ananda Tail. Is it?
Yeah.
Okay. What is the ingredient of?
The kalka which we use in it is Gairika and Jasada. Jasada Basma and Gairika, Shodhita Gairika. And the Kvata Pramana, we use all the Raktavargya Dravyas like Manjishta, Sariva, Rakta Chandana, all these Raktavargya Dravyas. Yeah, they are being used as Kvata Dravyas, and the Taila media is a Narikela Taila, coconut oil.
Coconut oil. Okay.
Sir, what is the reference like of that tailor?
No, it's basically from the folklore practice, and we are just using it, and it's a coined term as Ananda Taila. That's all, because it gives Ananda to the patient. All the irritability, everything gets down. That's the reason why we named it as Ananda Taila. It's a folklore one where we prepare it and use it.
Okay, sir.
Sir, in which dose you are using these Potalikalpas?
Usually it's around half to 1 rati, and per month it comes to around 8 ratis, regular one. Whereas with all the arsenic one, where you have the Vishagarbha, Talagarbha, Malagarbha, Shilagarbha, we use around 6 grams per month. And in case if it is something like Dhatu Garbha or Tamra Garbha, we are using is only approximately around 4 grams per month. So this is the dosage form how we are prescribing most of these Potalikalpanas. Hemagarbha, in case if the patient is having lots of issues related to the financial status, then we try to reduce the dosage considering the financial status, if at all, is around 6 grams per month, or else usual dosage is 8 grams. That is approximately 2 grams per week, around 125 milligram twice daily. This is a dosage which we are usually using it.
And this is in a single dose per day?
No, twice. 125 milligram twice daily. Or you can make it into 3 divided doses. 250 milligram per day in 3 divided doses.
Oh.
It's around 2 grams per week.
That is with in combination of other churnas or in a separate form?
Usually instead of churnas, it is better like you give it with kashayam, because you need to scrape it and give. Potalis are not supposed to be hammered. You don't powder it. Instead you scrape it and give just like chandan.
Okay.
And we use some anupanam, might we want to take it with dashamula or indukanta, whatever, and just scrape it over it and give it to the patient.
Okay, sir. Thank you.
There is no contraindication that it should not be mixed with powders. It can definitely, like as I said, in thyroid complaints and all, usually we give it with a combination of Avipattikara, Godanti, Abraka, Abhyadi, Makaradwaja and Tamragarbha Potali together in a house combination.
Thank you, sir.
Sir, and as you have told that Pradnya Bodhi Dravya, like Abrak or this Sugarna or this, that like it should be like 10 milligrams, like daily dose, or
No. It should be the classical dosage. You need to go is weekly 2 grams. See, I say at least you need to give the classical dosage for the initial 3 months at least. Try to see that the whole of the clinical condition like autoimmune system is being under control. Then try to get it to a moderate dosage. Might be instead of 8 grams per month, come to 6 grams. Then you come to 4 grams and try to see if at all you can maintain him with 2 grams per month. So this we have done many times, especially with this ulcerative colitis and all, where you might have to give treatments for long years. We reduce it considering the patient's health benefits in the clinical presentation.
Okay, sir. So it will be same like for Abrak also, it should be like a dose.
Yes.
Like,
Yes. Usually, yes. Yeah. The classical dosage forms.
and heme garbo, if you have the portally, then that like we take the Veda, like the round, that like how many Vedas like was that? That we can't like measure it. No, like, so like one Veda is like around like
Sorry, I did not get the question. Can you repeat?
if you have the portally like this, heme garbo, and like how many like we have to just go take the rounds like while like in honey or just like
Yeah. See, usually, the average strength which is given by a normal person, it takes around 20 to 30 circles. I will say the pottalis are stone-like. They are very hard. In case you start scraping it with some kashayam or kwatam, it gets immediately disintegrated. Then don't believe in those pottalis. They are tablets. They are not pottalis. Don't get faked away. The pottalis are usually hard enough. You scrape, it doesn't scrape that easily. The Rajatagarbha and Pravalagarbha, like pottalis which I give you, you try to scrape it, I'll give you 1 hour, you cannot scrape even 1 gram of it. They are just like stones. So it depends on the strength of the individual. You might have, sir, the patient is really not understood the way how he has to take. Then there are other means how we give this pottalis.